Hello, my name is Whitney Donaldson. Today we will go over ethical dilemmas in the endoscopy setting. The case study we will talk about today pertains to a 78-year-old female. Her past medical history is atrial fibrillation, hypertension, anxiety, depression, and history of kidney stones. Her past surgical procedures consist of catheter ablation for her atrial fib and lithotripsy for her kidney stones. Her chief complaints are difficulty swallowing, chest pain, weight loss, and hoarseness. Due to her chief complaints, the patient was scheduled for an EGD by her primary physician. At home, the patient helps care for her husband, her grown children, and her grandchildren. After the patient completed her EGD, she received her results. Her physician told her and her husband that she had chronic reflux causing Barrett's esophagus, a sliding hiatal hernia, and an esophageal mass. He assured that he had taken several biopsies of her esophagus and she would have the results soon. The patient was in shock. She began to cry. She was scared. Her physician let her know that once the lab results came back, he would then be able to give her her diagnosis, treatment options, and her prognosis. He believed the diagnosis was esophageal cancer. He stated that esophageal carcinoma is asymptomatic in the early stages and presents in the advanced stages. Esophageal cancer metastasizes rapidly, and therefore there is a poor prognosis. While she was waiting on her lab results, she was scheduled to undergo more testing. Testing used for finding out the diagnosis and staging of the possible cancer. She was scheduled for an ultrasound and a CAT scan. At this appointment, the patient's husband pulled the physician and the nurse to the side and asked them not to tell his wife of the prognosis. Her husband was afraid that she could not handle the bad news, if there was bad news to tell. At this point, the nurse and the physician were in a dilemma, an ethical dilemma, a situation in which an individual is compelled to make a choice between two actions. In this scenario, the patient is 78 years old. She is alert and oriented. She is intellectually intact. Therefore, it is a right of the patient to be informed about her prognosis. Would they let their emotions take over and cloud their judgment? The physician and the nurse thought about it. They thought that telling the patient would give her a sense of control. If she knew, she would be able to live the best life ahead for the time that she has left to live. Additionally, by telling the patient, it could alleviate any uncertainty. It could prepare her mentally and possibly allow her to achieve a more rapid recovery if there was treatment options. On one hand, the nurse and the physician thought about autonomy, which is one's ability to self-rule and to generate personal decisions independently. But on the other hand, they thought about beneficence, meaning to do good. The nurse's actions should benefit the patient and facilitate the patient's well-being. Beneficent actions help prevent harms and can also improve many situations. The nurse and the physician thought about what her husband said. What if she could not handle the bad news? What if she ended up in depression? What if she had an anxiety attack? What if she became violent and aggressive? What if she committed suicide? The controversy between autonomy and beneficence remains challenging for nurses and other healthcare employees today. The patient began asking the nurse, "Am I going to die?" What were they supposed to say? What were they supposed to do? Were they supposed to provide autonomy to the patient, tell her the prognosis, and veto the husband's opinion? Or were they supposed to provide beneficence and facilitate the patient's well-being? The lab results, the ultrasound, and the CAT scan results came back. The lab results showed adenocarcinoma. The ultrasound showed that the tumor had grown into the wall of the esophagus, and it had spread to several of the nearby lymph nodes. The CAT scan showed involvement with the diaphragm and the size of the tumor. They compared it to the size of a softball. The physician and the nurse thought it would be best to inform the patient about her prognosis. So they did. Fortunately, the patient and the patient's family were grateful for the honesty provided by the healthcare team. They were able to discuss what to expect, as well as treatment options, also support groups that they could all attend. Faced between these two principles, autonomy and beneficence, it is in the benefit of the patient to prevent her from harm, which can cause other consequences after disclosing the truth. However, preference is given to autonomy when the patient is capable of making decisions for themselves. Personal autonomy enables individuals to make independent decisions and to take their actions and use reason to establish moral values. Consciousness, cognition, and awareness of our own mortality allow us to script an independent survival reality and not merely react to environmental forces. Today we spoke about autonomy and beneficence. What would you do in this situation? What would you say? How would you react? It's something that we all need to think about as healthcare employees. One day we may be in that situation where we have to make that decision. In today's case, since the patient was intellectually intact and she could make her own decisions, autonomy won. And in the end, they were grateful for it so that she could prepare for the end, or she could prepare for treatment. I hope you enjoyed the presentation.